This is quite important. When I take care of patients, you see them and their family in the examination room, but you're missing something, and that something it's something you can get through a community engagement events like this, where you're meeting them in a more natural environment, where you meet their friends, their family, their community, and you connect with them in a different way. So if it's important to connect with the patient, I feel that this is not so easy to achieve that in the regular hospital environment. You have to be out there, you have to meet them, and in their natural environment. An event like this gives you a great opportunity to do that. Well, the question about what is the number one misconception about lung cancer is the fact that lung cancer affects only patients who smoke. So we know that about 10 to 20% of patients with non-small cell lung cancer, which is one of the major type of lung cancer, happens in patients who never smoked or smoked very little. So most people believe that when you get lung cancer it's because of smoking, and that is true, but there are also patients who never smoked or smoked very little that can get lung cancer. I think the question about how to take the first step to get screened is really to talk to your primary care physician or to the physician that you connect the most with. So the physician that you have the best relationship with, that you have a good rapport, a good kind of trusting relationship, so that you can get more information if you're eligible for screening. Most smokers are candidates and eligible for screening, especially above the age of 50. So it's very important to ask questions to your primary care, and if you're not satisfied with the answer, you may need to ask another person. So the question is, what are the important things to know about your diagnosis when you receive the diagnosis of lung cancer? So there are a couple of things that are important. Number one is important to have someone with you in the room when you receive the diagnosis. When you hear the word cancer, many times your brain shuts down. You don't think much about it. Having another person who will scribe and keep notes is quite important. The second thing is to ask questions about the type of lung cancer that you have. There are two major types, non-small and small cell lung cancer. Each type has different prognosis, different treatment options. Non-small cell lung cancer, we rely a lot of different biomarkers. So it's important to know not only if you have non-small cell lung cancer, but also what type of non-small cell lung cancer you have. That type determines, again, your prognosis, but also your treatment options. The other thing is it's important to allow your physician to connect with you in a way that will help you ask all of the questions that you have, so that you will leave the room in a way that you're not more confused, you're not more stressed, and you have a treatment plan in place. That is something quite important, and it always helps when you have a second person in the room, because they can be your kind of cheerleader and champion and person who will remind you that this is important. Because once you get into the room, again, your brain shuts down, you forget everything, you get out of the room and say, oh, I wish I had asked this, I wish I had asked the other question. But that person, or more than one, sometimes it's your support and your help in that kind of journey.